Welcome to our video series Taking Control of Your Child's Diabetes. My name is Lisette. I will review with you what diabetes is. Diabetes mellitus is a group of disorders affecting the management of glucose or sugar levels in the blood. Glucose comes from the foods that we eat and provides the cells with energy. After the glucose enters your bloodstream, insulin, which is a hormone produced by the pancreas, helps glucose move into the cells. People with diabetes have problems getting glucose in their cells for various reasons. When this happens, the body is starved of energy. Over time, high levels of glucose in the blood can hurt your eyes, your kidneys, nerves, and/or your heart. There are different types of diabetes. We will be discussing the most common, type 1 and type 2. Type 1 diabetes is usually diagnosed in childhood through young adulthood. It is also known as juvenile diabetes. In type 1, the body does not produce enough insulin or any insulin at all. This is what happens. First, the stomach changes food into glucose, which is also known as sugar. The glucose enters the bloodstream. Then the pancreas makes little or no insulin. Little of no insulin enters the bloodstream, and glucose builds up in the bloodstream. It is believed that 3 things cause type 1 diabetes. The first one is genetics. Over 50% of diagnosed kids have inherited the gene combination DR3, DR4 from their parents. The second cause is the autoimmune response. The body's autoimmune system begins to attack its own parts because it thinks they don't belong inside the body. With type 1 diabetes, the body attacks the islet cells in the pancreas where the insulin is made. The damaged islet cells then cause the immune system to develop something called antibodies. The third cause can be a virus, chemicals, or the environment. Our genetic makeup determines if a body will allow a virus, a chemical, or a substance in the environment to get into the islet cells and cause damage. So what is the treatment for type 1 diabetes? Proper management includes balancing insulin, food, and exercise to control blood glucose. Now, let's talk about type 2 diabetes. Type 2 is the most common type of diabetes. It is often associated with being overweight. Type 2 occurs when the body doesn't produce enough insulin or the cells do not respond well to it. They become insulin resistant. At first, the pancreas will make extra insulin to make up for the cell's resistance. However, with time, the pancreas can no longer keep up. People with type 2 diabetes may have normal or high insulin levels. Type 2 diabetes usually occurs over the age of 40, but is now more commonly seen in overweight children and teenagers. This is what happens inside the body. First, the stomach changes food into glucose. Second, glucose enters the bloodstream. Third step is the pancreas makes insulin. Then the insulin enters the bloodstream. The glucose cannot get into the cells or the body, so the glucose starts to build up in the blood vessels. What causes type 2 diabetes? Well, just like type 1, genetics is the first cause. You have a greater chance of developing type 2 diabetes if your parents have it. The genetic mutation that causes it is still unknown. The second cause is based on lifestyle choices such as lack of exercise, unhealthy eating, and being overweight. So what is the treatment for type 2 diabetes? First, lifestyle changes such as improving diet and exercising. 30 to 60 minutes of exercise at least 5 times a week is important for everyone. Also, oral medications may help. If this does not work, insulin injections are used. The most commonly seen symptoms include being very thirsty, needing to pass urine more often than usual, and being very hungry. So there you have it. Remember, we are here for your child and to support you. If you have any questions, do not hesitate to contact your diabetes team. Please continue watching this video series to learn more. Thank you for being an active member of your child's diabetes team.